Hi, my name is Katie, and today we're going to be discussing chronic obstructive pulmonary disease. COPD is a common lung disease causing restricted airflow and breathing problems. It originates from either chronic bronchitis or emphysema. Today, my presentation will be focusing on COPD originating from emphysema. COPD is very relevant to public health, as it is the fourth leading cause of death worldwide, causing approximately 3.5 million deaths in 2021. Also in 2021, 11.7 million insured individuals had COPD in the United States, and there were 1.8 million COPD-related acute inpatient hospitalizations nationwide. Tobacco smoking accounts for approximately 70% of all COPD cases in high-income countries. This disease has affected my family, as my uncle passed away from complications of chronic obstructive pulmonary disease in 2019. I witnessed firsthand the devastating effects of this disease and the impact it has on an individual's quality of life. As we can see here in this illustration, COPD is an umbrella term that refers to chronic lung disorders that cause problems with breathing. Emphysema is one of the main types of chronic obstructive pulmonary disease. Emphysema affects the alveoli in your lungs, causing persistent damage, and it affects your ability to breathe. 75% of emphysema cases are caused by smoking. However, a non-smoking individual can develop emphysema from exposure to smoke, such as secondhand smoke, smoke from wood burning stoves, or coal. Exposure to other environmental chemicals and irritants, including air pollution, can also cause emphysema. It also can be caused by a genetic disorder called alpha-1 antitrypsin deficiency, which is an inherited genetic disorder that causes low levels of a protein called AAT that protects your lungs. In healthy lungs, air enters the nose and mouth, travels down the trachea and into the bronchial tubes. These bronchial tubes branch out into smaller tubes called bronchioles. The bronchioles end in clusters of tiny air sacs called alveoli. Alveoli are elastic, which means they can change their size and shape. They have a special coating inside called surfactant, which allows your lungs to inflate easily and also prevents your lungs from collapsing when you exhale. Each alveoli is made up of a mesh of tiny blood vessels called capillaries, and these capillaries connect to arteries and veins that circulate blood throughout the body. Gas exchange takes place in the millions of alveoli in the lungs and the capillaries that envelop them. The pulmonary artery and its branches deliver blood to the capillaries that surround the alveoli. This blood is rich in carbon dioxide and low in oxygen. Carbon dioxide moves from the blood into the air inside the alveoli. At the same time, oxygen moves from the air into the blood in the capillaries. When an individual has prolonged exposure to smoke or harmful chemicals, an inflammatory response happens. Macrophages are activated, and this releases neutrophil chemotactic factors. Both the macrophages and the neutrophils then release different proteinases that cause mucus hypersecretion. An imbalance between the enzymes elastase and anti-elastase increases susceptibility to lung destruction, resulting in airspace enlargement. These enzymes also break down the elastin in the bronchioles and alveoli, causing damage to these tissues. Cytotoxic T cells released in the immune response release perforins, which destroy cells and cause more damage to the alveolar wall. This damage decreases the amount of alveolar and capillary surface area. As we discussed in the previous slide, this surface area is critical for exchanging oxygen and carbon dioxide. This decreased surface space causes difficulty when an individual is trying to move air out of their lungs and does not allow room for oxygen-rich air to enter into your lungs. Some patients have emphysema for years without noticing. The most common sign that make people aware that something is wrong is shortness of breath. This may happen when you are exerting yourself, like exercising or climbing stairs. The typical symptoms of emphysema are shortness of breath, frequent respiratory infections, increased mucus production, chest pain or tightness, coughing, wheezing, and feeling very tired. As the disease progresses, weight loss can occur and swelling in the ankles. When there is a severe lack of oxygen in your blood, your lips or fingernails can turn blue or gray during any physical activity. Diagnosis of emphysema includes a physical examination by a doctor who can listen to your lungs. In addition, tests like a chest X-ray, CT scan, pulmonary function testing, and arterial blood gas can be used to evaluate how advanced your emphysema is. If you are a smoker, quitting smoking is one of the best ways to slow down the progression of the disease. Your doctor will also prescribe bronchodilators, which relax the muscles around your airways, corticosteroids, antibiotics, anti-inflammatory meds, and as the disease progresses, oxygen therapy. In some emphysema cases, a physician can remove a portion of the damaged lung tissue and join the remaining tissue together in a surgery called lung volume reduction therapy. But this is not an option for all cases. There is also lung transplant surgery. One of the most promising future treatments is being researched by Dr. Wei Zhu at Tongji University in China. Stem cell and progenitor cell-based regenerative medicine are being used to regenerate the tissues of the airways. Progenitor cells are taken from the COPD subject's lungs and are used to grow millions more in a laboratory. These cells are then transplanted back into the patient's lungs. After 12 weeks, the diffusing capacity of the lungs improved from 30% to 39.7%, and then increased to 40.3% at 24 weeks. This therapy is proven to help in mild cases of emphysema, but not in severe cases. The United States Preventative Task Force does not recommend primary care physicians screening patients for COPD who are asymptomatic. However, primary care doctors do need to recognize patients that have increased risk factors for developing COPD. Patients who smoke should be given assistance and counseling to stop smoking. Patients who have specific occupations that expose them to dust, fumes, or toxic chemicals are at an increased risk of developing emphysema, such as farm workers, vehicle mechanics, material moving workers, and hospitality cleaning staff. Age is also a risk factor, as the prevalence of COPD is 2 to 3 times higher in people aged 60 and over. Genetics can also be a risk factor if a patient has a family history of alpha-1 antitrypsin deficiency. It is especially important that primary care doctors take time to educate high-risk patients on emphysema and make them aware of certain symptoms that indicate a visit to their doctor to get checked out. One of the most impactful ways health practitioners can help newly diagnosed emphysema patients is by helping them to stop smoking. Smoking is associated with a 10-year reduction in life expectancy. Providing resources for your patients, such as tobacco counseling and nicotine replacement therapy, can actually slow down the progression of the disease. Patients with mild cases of emphysema should be encouraged to participate in light physical activity, as it has been proven to improve symptoms and quality of life. Educating patients on the importance of getting their influenza and pneumococcal vaccines to decrease their risk of hospitalizations is also very important. Nutrition can also help maintain good health and strengthen emphysema patients. Educating patients on intaking lots of fresh fruit and vegetables and decreasing the amount of inflammatory foods such as high sugar and high saturated fat. Though emphysema is not reversible, providing your patients with these tools early on can improve the quality of their life and slow down the progression of their disease.